Coming to the types of sedation, first is the minimal sedation or the anxiolysis. Here it is a drug-induced state during which the patient responds normally to the verbal commands, although cognitive functions and coordination may be impaired of the patient, whereas the ventilatory and cardiovascular functions are unaffected in the first type, that is the minimal sedation. Moderate sedation is the second type. It is also considered as the conscious sedation. It is a drug-induced depression of consciousness during which the patient responds purposefully to the verbal commands, either alone or accompanied by light tactile stimulation. Here, no interventions are required to maintain a patent airway and spontaneous ventilation is adequate. Cardiovascular function is usually maintained in the moderate sedation. Okay, the third type of sedation is the deep sedation or the analgesia. Here usually the patient will be in a state of unconsciousness and the patient will not respond properly, and only the patient can be responsive on the repeated painful stimulation. Here, we need to support the patient's ventilation by administering oxygen, maintain patent airway by spontaneous ventilation, which may be inadequate for the patient under the deep sedation. And also the cardiovascular function is usually maintained during this type of sedation. So here what you need to do is you need to focus on the respiratory pattern of the patient and suctioning of the patient, as well as proper oxygenation of patient to be maintained. During the fourth type of sedation, that is the anesthesia, here usually complete, that may be the general anesthesia or the spinal anesthesia or regional anesthesia, complete, there will be loss of consciousness of patient. Even with the repeated painful stimuli also the patient will not be arousable. You need to maintain the ventilatory functions of the patient by the positive pressure ventilators, positive pressure ventilation. Okay, here neuromuscular functions will be completely depressed, as well as the cardiovascular functions may be impaired. So we need to have like close and continuous monitoring of the patient on anesthesia. Okay, so these are the four types of sedations what usually carries out in the operation theaters to perform any of the procedure intraoperatively. Coming to the nursing responsibilities for the patient under the sedation or post-operative sedation, is the patient, pre-operatively, the patient must be NPO in order to prevent the aspiration and other respiratory disorders for the patient to be avoided. So the patient will be NPO, and thorough examination by the anesthetist will be done prior to the surgery, so that any of the complications can be avoided during the procedure and the post procedure. And IVSS must be maintained for the patient. Allergies must be checked. All the histories of the patient, like medical, surgical, post previous blood transfusion of the patient, these all histories to be collected. And also allergies is very important, because most of the patient may be allergic, and medications what will be given during the time of operation will be playing a vital role on the patient health condition. Continuous monitoring of the patient to be done pre intraoperatively as well as the post-operatively when the patient is on the sedation through the pulse oximeter, vitals, etc. Consent form is must and should prior to the sedation by the patient as well as from the relatives of the patient. Pain assessment must be done prior selecting the type of sedation, either the minimal, mild, or moderate, or the deep, or the anesthesia. And also based on the type of operation the patient is undergoing, the sedation will be selected. Thank you.